am your moderator for this Intimacy and Endometriosis panel. I am a certified holistic health practitioner here in the state of Georgia. I'm also an endo warrior, endo educator, and so today we're going to be talking to Dr. Shantae Williams. I'm excited for this conversation. We're going to get into some spicy things when it comes to intimacy while you have endometriosis. Okay, so before we get started with the conversation, I would like to give Dr. Shantae a chance to introduce herself, let you all know everything that she does in this space.
Yes, so I'll keep this short because I don't love talking about myself. But yes, I am a pelvic floor physical therapist. So I just want to get an idea, how many people in this room have had pelvic floor physical therapy? Okay, so a handful. And how many people have been told to go to pelvic floor physical therapy? Okay. So I do want to say pelvic floor physical therapy is helpful, not just for the endometriosis community, but for a lot of people, and we can talk about that a little bit later. But as Samantha was saying, my name is Dr. Shantae. I am a Midwest girl, and I've been in Atlanta for 2 years. I've been practicing for about, 14, 15 years in pelvic health, and I just love working with the endometriosis population. So that's definitely a passion of mine, and yeah, that's it. Just a quick plug, I do have an endometriosis support and educational group that I'm starting in the Atlanta area. Our last session was in March to celebrate Endometriosis Support Month, Awareness Month, and we're hoping to have another one end of April or end of April or beginning of May. So if you want to follow endo_meetup on Instagram, that's where you'll get most of your updates.
Okay, y'all make sure y'all follow. So if you live here in Atlanta, you can connect with your endo sisters, because I know sometimes it's hard to meet people who have endometriosis. So make sure you guys follow so you can go to the meetups and the events and everything. So we're going to get started. My first question. In your holistic approach to treating pelvic health conditions, how do you navigate the intersection of physical and emotional well-being, particularly when addressing issues like chronic pain and sexual dysfunction?
Yes, so I learned early on in my career, pretty early on, that I can't just treat the musculoskeletal system and be successful, especially with things like chronic pain and sexual dysfunction. There is such a huge mind-body connection, so I spend a lot of time just educating my patients on that mind-body connection and incorporating things like practicing mindfulness in our sessions, working on a lot of breath work that can be very helpful as well. I also talk about things like stress management, nutrition and diet can play a role, and obviously I do have my limitations, so I will refer out if necessary. I'm also a huge component of mental health therapy. I have had it myself. I personally think that everyone can benefit from having a mental health therapist at some point in their lives. And especially in the endometriosis community, you're dealing with chronic issues like pain and bowel and bladder symptoms, and this can be a micro trauma, right? And medical gaslighting is a thing, so it's really important to seek that guidance and work with a professional to work through some of these traumas, and I think that can be very helpful in the healing experience as well. So right off the bat, I'm normalizing mental health therapy as well as physical therapy. If people are resistant to it, I'm often, calling a mental health therapist a life coach, because they're kind of like a life coach. They help us see our blocks and can really help with that, healing process.
Don't skip by the breath work, okay?
Very important.
Very important. I'm very much so an advocate for breath work, because we do a lot, we are going through a lot, and a lot of times we forget to breathe. And I mean, like, be intentional with breath, so don't bypass the breath work too in this response, because it's very, very important. Okay, so you specialize in pelvic floor and obstetrics. How can pelvic health practices contribute to better outcomes for women dealing with endometriosis, and are there specific exercises or approaches that you would recommend?
Yeah, so pelvic health physical therapy can really help with a lot of the symptoms that people with endometriosis deal with. So obviously pain, that's a huge one, but also bladder symptoms and bowel symptoms and sexual function. So we're helping patients to manage these symptoms with certain manual techniques, certain exercises, and then we also play a huge role in if you know you're getting and if you're planning on going forward with an excision surgery, we can play a huge role in surgical prep, in getting the nervous system, the muscles and the nerves in an optimal position to enter into a surgery to create better outcomes after a surgery. We can also help post-op with scar management and just getting you back to doing the things that you love to do and the things that you have to do in a way that allows for that healing process. So we can be very helpful in those aspects.
Okay, so discussing endometriosis and its impact on sex can be challenging. We know this, especially when you suffer with endo, and that's really one of the telltale signs of having endo is having painful sex. What advice do you offer to individuals on initiating a conversation with their partners about this topic because it's so sensitive?
Yeah, so that's a tough one. Obviously, it depends on like who your partner is. It's if you're having, like, say you're having pain with sex, it's so important for your partner to know that, right? And I know my limitations. Like, I'm not a mental health therapist, obviously, although I do get the pleasure of spending weekly sessions with my patients and, for hours, and we talk about a lot of these things. I'm not a mental health therapist. So if you're having trouble initiating that conversation, or maybe your partner is a little resistant to that conversation, then their sex therapists are worth their weight in gold. A good sex therapist can be really helpful, possibly like a couples therapist, possibly a mental health therapist. So I'm definitely referring out if I need to.
Yeah, and I think painful sex is kind of a normalized thing in a way. I think sometimes we feel like that's how sex is supposed to feel, and so sometimes we don't know that sex is not supposed to be a painful thing. So that's really important.
So that's a good point, and I'll actually have a lot of patients that come in and they think it's normal, right? Like, and there's other healthcare providers and doctors that are telling y'all that this is normal, right? I can't even count how many times throughout my career I've heard patients tell me, like, okay, I have a little bit of pain with sex, but my doctor told me that that's normal, and they told me to drink a glass of wine before I have sex, and that should help. Like, that's not really medical advice, right? So, yes, absolutely, we need to educate people and let them know that sex is not normal with pain, or pain is not normal with sex, and sex should be pleasurable.
So how can partners actively participate in the treatment journey, and what role can they play in supporting their loved one's sexual well-being when dealing with endometriosis?
Again, it depends on the partner. So I'll oftentimes invite partners into the treatment sessions if both parties are on board with that. It just gives me an opportunity to explain what pelvic floor physical therapy is to the partner, and really explain like what's going on with their loved one. And it just helps with, support and just understanding what's going on. And oftentimes I'll teach some of the treatment techniques. So if the partner wants to learn how to do manual release to the pelvic floor muscles, I'll teach that. If they want to learn how to do like scar tissue mobilization, I'll teach that. I also will often encourage partners or couples to do exercises together, so like the breath work or the exercises, and that can actually help in building some intimacy.
A little bit of tantra.
Yes.
A little bit of eye gazing, yes. So in your practice, how do you approach conversations about sexual dysfunction with patients who have endometriosis, and what advice do you provide to help them improve intimacy and sexual comfort?
So I start by just really building trust, right? Like when I see a patient for the first time, I'm letting them know that nothing is off the table. I want to know everything. I think that listening is very important. because a lot of providers don't listen to their patients. So I'm giving them the space to really tell me anything they want to share. I want to know all the things. Obviously, the more information that you tell me will be helpful for our treatment. But not everyone feels comfortable. Like, I'm a stranger. When you come into my clinic for the first time, I'm a stranger. You're not necessarily going to feel comfortable sharing all of these like intimate details with me. That kind of builds over time. So I just really provide a safe, non-judgmental space for my patients. And oftentimes, as people continue to start to feel more comfortable, then they share more and more.
Now, for individuals who are experiencing pain during sexual activity due to endometriosis, what are some targeted exercises or techniques that you would recommend to help alleviate the discomfort and to help improve the sexual satisfaction?
So that depends on the individual. No two patients with endometriosis are the same. So really it just depends on, what their symptoms are, what their history is, and whatnot. Some common exercises that I tend to give to the majority of my patients, as we were just talking about earlier, breath work is very important, specifically diaphragmatic breathing. The pelvic floor and the diaphragm really have this cohesive relationship where they move together. So if you're doing diaphragmatic breathing and the lungs are expanding with air, your diaphragm is actually dropping down and the pelvic floor is dropping down. So just by doing that breathing exercise, you're actually mobilizing the pelvic floor. So we love to talk about breathing. Not only that, it helps with so many other things. So it can help with digestion, it can help with the lymphatic system, so inflammation. It can also help to regulate the nervous system. So we know that dealing with chronic issues can really make your nervous system hypersensitive and can really lower your pain-free tolerance. We're really working on things to try to regulate the nervous system, and the diaphragmatic breathing is a huge thing that you can do to start to lower the heart rate and start to kick in those parasympathetic responses. The parasympathetic system is opposite of like that fight or flight that we're constantly living in if we're in chronic pain, or if we're maybe peeing every time we have sex. We're on guard where our fight or flight is kicking in. And then I often will give hip stretches and hip openers to my patients too. There's a huge relationship between the hips and the pelvic floor. They share common attachment sites. They share connective tissue. So sometimes stretching the hips and just improving that flexibility and improving that mobility can really help the pelvic floor move and function better as well. And then I'm just going to segue over here to these tools that I have on the table here. These are great self-treatment tools. So if you've been to physical therapy, your physical therapist might have recommended that you buy one of these tools and start to work on some of the treatment at home on your own. This is a pelvic wand. So this is inserted into either the vaginal canal or the rectal canal, and you can do a muscle release. So you're trying to get the pelvic floor muscles to relax by using this tool. These are dilators or trainers. So vaginal dilators, they also make rectal dilators as well. I just have the vaginal ones with me today. But they graduate in size. So you're starting with the size that is most tolerable, and you're working on desensitizing the muscles and the nerves. So you're retraining the musculoskeletal system to be able to tolerate the specific size, and then as you become more comfortable with that size, you're slowly, working your way up to whatever your goal is. So if your goal is a pain-free pelvic exam, then you might not have to go up to this guy right here. But if your goal is pain-free penetrative sex, then yes, we're working our ways up to one of the larger sizes there. These fun things I just brought because they're not really treatment, but they can help with deep penetrative pain. It's called the ONA. So a person with endometriosis did develop these, but they're little stackable rings that control the depth of penetration. So and you can adjust it. So for the vulva owner, you're controlling that depth if you have pain with deeper penetration. And then for the penis owner, it doesn't feel like, you're limited there. It still feels like full penetration. So it's a great, I get great feedback from my patients on that. It's a great tool.
Wow. I didn't know where we were going with these, but wow. I will say, as a testament, hip movements are everything. We were just having a conversation out there about this. We have a lot of trauma that is trapped in our womb spaces, which can cause a lot of reproductive discord. And a lot of times we don't move our hips. And because we don't move our hips, a lot of the energy that's there doesn't get released. And so doing hip movements, I feel like if you don't do any other kind of exercising, moving your hips is really, really good. And you don't have to, do something super strenuous when it comes to moving your hips. Just cut on some music and start twerking around the house. It can be just that simple, just to kind of help to release the energy that is trapped and stored in the womb space. So I love that. Now, when discussing sexual discomfort and that knowing that it can be emotionally charged, what kinds of tips can you provide for individuals to express their concerns and needs without causing a strain on their relationship? Because I've been there, and it was endometriosis and the stigmas around it and sex was part of the reason why my last relationship didn't work. And it was a lot of strain.
So I think educating the partner is very important. So if that partner is willing to come into one of your treatment sessions, then let's educate the partner. Let's get the partner on board, right? Let's get the partner helping with treatment. And really just on my end, encouraging that conversation. I have seen people, come into the clinic and they're like, I have pain with sex, but my partner doesn't know that. I don't want them to know that. I just grin and bear it. And I feel like we tend to do that. We tend to grin and bear throughout our discomfort to please others. And that's not fair, right? Like, just really discouraging that and encouraging that conversation to happen. And then if need be, referring that person out to see maybe a couples therapy or a sex therapist or even an individual therapist to help with that.
Now, how can couples collaborate to explore alternative intimate activities that prioritize comfort and pleasure and that provides a supportive space for those who have endometriosis?
I think it's important to kind of reframe sex and intimacy. It's not always going to be, people have sex in many different ways, right? So it's not always going to be, penis and vagina. That's the only way that I can have sex, and that's the only way that I can have intimacy. And sex doesn't equal intimacy either. Conversing, having those deep conversations is a way to develop intimacy. Maybe doing a couples massage or giving each other massages. One thing that I do talk to my patients about often is sensate focus. And you can Google that. There's a lot of information on the internet about sensate focus. But this is a technique that a lot of sex therapists will give their clients for homework. And it's really just like it's a partnered activity. You're introducing safe touch that is non-sexual. So they encourage you to really start off non-sexual touch, and you're just building up to sexual activity. So it's a great way to develop intimacy, and it's also a great way to regulate the nervous system. So a lot of times if you have history of, either trauma or pain with sex, your body kind of holds on to that, right? And your nervous system is triggered when maybe you even think about sex or you're even touched in a way. So it's a really great way to start to downregulate the nervous system and work towards feeling safe with sexual activity.
That's a really good point. Eye gazing is good too. If you all haven't tried that, if you have a partner, try eye gazing as well. Just thinking thoughts without saying them. That helps to build the intimacy and the trust as well. Because with intimacy comes trust. You have to be able to trust your partner to be intimate with them. So how can incorporating pelvic floor exercises into a routine benefit individuals with endometriosis, especially when it's addressing issues like the pelvic pain and discomfort during sex?
Yeah, so if you've been to physical therapy, not even just like pelvic floor physical therapy, you know that we like to give a lot of homework. And if you're more consistent with your home program, you're going to make better progress. So developing a routine of doing your exercises, it's only going to be helpful, right? And aside from when you're in physical therapy, just continuing some of these routines for maintenance so that you're maintaining good pelvic health is important too. And that can include maybe not like every single exercise that you've done in physical therapy, but that can include maybe like just some daily general breath work or just making sure that you have a good flexibility program. Movement is so important, so finding some sort of movement or exercise that you enjoy to do that increases the endorphins. Endorphins can help with pain levels. It's just really helpful to keep moving and keep your pelvic floor muscles in good shape.
So for individuals with endo who may be apprehensive about engaging in sexual activity due to the pain and the anxiety, what kind of advice would you offer to them to help them navigate and have a fulfilling sexual life that is enjoyable?
Yeah, so I think as you said earlier, it's important to really educate people that sex should not be painful and that sex should be enjoyable. And there's a lot of people out there having bad sex and thinking that this is normal, right? So I want to get it out there that that's not normal, and there's things that you can do to help for that, right? And let's just figure out what's going on, and let's try to fix whatever it is. That may not just be pelvic floor physical therapy. We might have to have like a good excision surgery. We might have to, do some alternative therapies like acupuncture, I don't know, but let's figure it out so that sex can be pain-free and sex can be enjoyable.
Okay, and this is our last question. As someone who believes in treating the whole person, how can healthcare professionals work collaboratively to provide comprehensive care for women with endometriosis, addressing both physical and emotional aspects?
Yeah, so this is a great question. I always like to say that it takes a village to treat endometriosis, because a lot of times you're not going to find the answer with just one thing. You're not going to find, complete symptom relief. It could happen. Let me take that back. It could happen. But likely you're not going to find complete symptom relief with just pelvic floor physical therapy. So as a pelvic floor physical therapist, I think one of the best things that I can do is really lead my patients to the right professionals, so you're not, wasting your time going from this provider and this provider and this provider. So I like to call that the medical dream team, and that may look different for every, each individual. That may look different, but usually that's involving pelvic floor physical therapy. It may or may not involve like an excision surgery. It may involve a nutritionist. It may involve like a fertility specialist. It might be an acupuncturist, a nutritionist, a dietitian, people that know endo. And as pelvic floor physical therapists, we're working with these different providers, so we have those connections. So I like to spend a lot of time, sitting down with my patients and figuring out like, okay, who are you seeing? What surgery have you had in the past? Was it successful? Was it done by, just a general OB who doesn't know endo? Okay, let's get you into the right hands there. What else is going on? Have you tried this? Have you tried this? So really finding that medical dream team is super important in your healing process. And I think since we spend so much time with you guys, we can be really an important piece of helping you find that team. And then, of course, like communication between the providers is super important too.
Okay, so before we start to take questions, would you like to give any last-minute advice?
Yeah, so I think pelvic floor physical therapy is really important. I get the question a lot, does everyone with endometriosis need pelvic floor physical therapy? Not necessarily. So I do have people referred to me with pain, and I'm checking their pelvic floor, and their pelvic floor is just fine. But with that being said, we can help with a lot of different things too. So we can help with, surgical prep, recovery from surgery. We can help with working on the scars and the adhesions. We can work on, when you spend years dealing with, bowel issues or pain, you learn you learn how to compensate from that. So, okay, let's fix those compensatory strategies. Let's work on strengthening the muscles that, you know, are weak, and stretching and relaxing the muscles that are guarding and that are tight. So I do think it can be very valuable to see a pelvic floor physical therapist at one point, just to, you know, get some guidance on how to better manage your symptoms.
Okay, y'all, add a pelvic floor therapist to your people if you don't have one, okay? And I'm going to give y'all a piece of advice. Y'all didn't ask me, but I'm going to give it to you anyway. So as we are talking about intimacy with endometriosis, and we're talking about intimacy with your partner, I think it's important to have the intention to create intimacy with yourself, because y'all know when you have endo, we go through an array of emotions. A lot of times we see ourselves in the mirror. We kind of don't recognize the person that we see because we have so many phases of endo that we go through. But then you change in those phases as well, and sometimes you might not recognize the person that you see. And so developing intimacy with yourself, learning yourself, especially with having endo, because having endo and who you are now is not the person that you was before you knew you had endo, before you had the name with the face. So establishing intimacy with yourself, being able to know what you like, don't know what you like, being able to harvest a relationship with your body is very, very important, and being able to give intimacy to yourself, even though you might be craving it from other people or from a particular person. It's very important to give yourself that intimacy that you are craving, because you love yourself more than anybody else. And so you have to feel that energy of love being propelled into yourself, especially when you're dealing with something like endometriosis, because it strips us and makes us feel like we aren't women anymore, because we can't, our body won't allow us to do certain things. And so I think that's really important, to start establishing an intimate relationship with yourself. So that's my tidbit for today. Okay, now does anybody have any questions? I was about to say, y'all don't have no questions?
Hello. So I think it's crazy for me because I didn't actually find out about pelvic floor treatment, therapy, whatever, until like after my third surgery. So with scar tissue and all of that we got going on down here, how often would you say a person should do these practices or these, trainings, treatments, etc.?
So that also just depends on the individual, but usually I'm seeing a patient weekly, so once a week. You're getting lots of homework and stuff to do on your own. And I would say for more chronic issues, yes, you're probably going to be seeing your pelvic floor therapist for a longer period of time. But that doesn't even have to be like, back to back. Establish a home program, and then maybe we can start spreading out the sessions. Maybe we can check back, every few months, and just to see how you're doing, maybe learn some new manual techniques and whatnot. But really, we like to empower you guys and pass the baton on to you and teach you everything we know so that you can be in power of your body and yourself and manage your own symptoms. But starting off, usually I'll do once a week for like maybe 6 to 8 sessions and go from there.
Does anyone else have any questions?
Super new. So is this something covered by insurance? Is it out of pocket? Is it costly or not costly?
Depends on where you live. In the state of Georgia, and I was actually a little shocked by this too. I was coming from Chicago, and then I started practicing in the Atlanta area, and no one down here takes insurance. No one, and it's quite expensive, right? So you're looking at anywhere, at least in this area, from like $200 to $300, and I think that is because the reimbursement rate in the state of Georgia is a lot lower for physical therapy. So a lot of physical therapists tend to go into private practice, and unfortunately, they can't take insurance like that, but they do provide super bills for out-of-network benefits. So it really just depends on like what your particular insurance covers for out-of-network. There are places that take insurance. Just in the state of Georgia, there's not that many, but there are, and they usually work in like hospital-based systems.
Anybody else?
Okay, so as someone, I was diagnosed with premature ovarian failure at 32. I'm 37 years old, so I went through menopause at 32 years old. And after my 7th surgery is when they recommended the pelvic floor therapy. Then that's when I tried to start with IVF and then got diagnosed with premature ovarian failure, went through menopause, and here I am. Then COVID happened, so the world shut down. So here I am now, and I'm on hormone therapy now. I'm on the estrogen patch, and then I'm also on oral progesterone. If you have not been through menopause and have not taken those hormones, then you know that your sex drive decreases like dramatically, like to the point of I don't want it, but what's wrong with me? I'm not a woman. Okay, so now I want to kill. Like you just deal with all these emotions. So now I was speaking to one of my other endo sisters from Samantha Health about how, okay, so now this hormone therapy has been helping. I love sex now. I want to have it all the time. She's working like she should work. How can the pelvic floor therapy kind of like help that? Because I know that that is something that was recommended to me, but then everything else in life happened. And I didn't go through with it. So where should I start? And then once I do start, how will that kind of like improve like my quality of life?
So sex is very layered, as we know, right? There's definitely a hormonal component, there's an emotional component, there's a mental component, and there's a musculoskeletal component. So the pelvic floor muscles do play a role in arousal and orgasm. Getting those muscles to move better can really help. When we orgasm, our muscles actually maximally contract and relax, thousands of times or hundreds of times. Yeah. And if those muscles are kind of stuck in this holding pattern, then they're not moving well, right? And you're not going to perhaps get a great orgasm. And then aside from that, if you have a history of pain with sex, or if you're having pain with sex, who wants to have sex, right? Like that's definitely going to affect your libido as well. So pelvic floor physical therapy can help by just getting the pelvic floor muscles to engage and move better. Also, we're working on like the nerves that innervate that area too. Are there any restrictions along the nerve pathway? And those nerves start anywhere. Actually, the nerves start from our central nervous system, right? So our brain, our brainstem, our spinal cord, but all of those spinal nerves as well, especially the spinal nerves leaving the lower part of the back. Are there any restrictions there? Do you have back pain, right? So everything's really connected. And then getting those muscles to move and to exercise those muscles, that also increases good blood flow to the area too. So circulation is also important for, orgasms, for pleasure, for arousal, things like that. So it's really just a piece of the puzzle, an important piece of the puzzle.
Anybody else have any questions? No? Okay. Well, thank you, Dr. Shantae, for all of this great and vital information, especially about pelvic floor therapy. I find that pelvic floor is one of the best treatments for managing endometriosis with acupuncture. So thank you so much for all of these tools and explaining us how they work and everything. No,
my IG is drtay.pelvicpt. I believe that's it. I think I recently changed it. But it should pop up if you type in Dr. Tae, Tae. Did you find it? Okay, great.
Thank you guys so much. Thank you to all of our panelists. Thank you to our attendees. And I just want to give a quick shout out to our sponsors, Sumitomo Pharmaceuticals of America, Pfizer, Black Doctor Organization, Her Poppy, Lunette, Operation Mist, and Semane Health, which I use. So we wanted to thank you guys so much for sponsoring this amazing event. We also want to say, make sure you take some photos at the photo booth before you leave, okay? Make sure you get your goodie bag and grab whatever you can before you leave. And I'm just going to go ahead and pass the mic to Lauren. And I want to say thank you for allowing me to be your moderator, host, MC, period.
Hello, everyone. Again, this is the end of the event. I want to say thank you so much to Sam, Casey. They do all of this work. I love them so, so, so much. Thank you to all of the panelists. Dr. Tay, thank you. Y'all, I hit her up on the whim. I did. And she was like, sure, I definitely will come and support and share. And I'm just glad that you were able to share so much knowledge. And I hope that you all follow her. She's always providing really good information to you all. And you always, if possible, can hit her up in her DM. Her practice here is in Atlanta. There's no need to move around to other places when we have somebody that's here, that's doing the work, that's able to help you. So definitely reach out to her if you have any questions.
Can I just add that there is a melanated pelvic floor PT directory, and it is, yes, it is actually there's international too. We now have therapists in Jamaica and I think Haiti, but it's a really great resource. I can give you that link, and then maybe you can pass it on to everyone. Yeah, yep, but you can search by area for a therapist of color.
Thank you for that. I'll add it to our website, endoblack.org. If you all are not familiar, that is our website. Please look it up. We also, of course, have Empowering Endo Sistas -sistas.com. Please just use that information, share that information, get the information out. We are raising awareness about endometriosis among African American women. We have to change that narrative. It is very difficult as it is. It is a crazy time in the world right now. But what I have learned is that it will always be a crazy time in the world, and we're in it. So we're going to thrive with endometriosis. We're going to thrive as Black women. We're going to thrive as women in this world and continue to do the work that we have to do. And I appreciate you all for coming out, for you supporting, for you being present in this moment. And I hope that you are all able to get some information from this and meet your endo tribe and connect with each other and learn more about endometriosis. There's so many different things that we have to unpack. For those who do not know, we often do an annual conference as well as our gala. We have actually stopped that. We are now venturing into focusing only on programs as well as research. So that looks like doing events like this in different states, and we're hoping that we get that funding so that we can go to Texas, so that we can go to Louisiana, so we can go to California and do things like this in their area, and hopefully it will bring out women who are trying to get accurate diagnoses or they already have endometriosis and they can form their endo tribe together. So again, thank you so much for coming out. Again, like she said, the photo booth, definitely get that. Make sure you pick up your endo symptom tracker. How many of you have it? Because I'm looking at y'all. Make sure you get that information, even if you already have endometriosis and you know, take that information. If you are working at a school, if you are working at the government office, if you are working at the post office, I don't care if you're working at McDonald's. Take that information with you. Make sure that people next to you understand, because people are learning about endometriosis, but we have to be careful about the information that they're learning and what they're learning, and understanding that the information that we funnel out into the community is very, very impactful. So, you know, we all have so many advocates in the audience, so many new advocates, because I know I can see it in you that you're interested in getting this information out, and I'm really excited. But let's make sure that we are taking the accurate information out and funneling it to the community so that we can make sure we get those accurate diagnoses among women in general, okay? Does anybody have any questions? Is everybody following Endo Black? Oh, okay, good. Now, if you are not, it is Endo_Black on Instagram. We are on Pinterest. We're on Instagram. We're on LinkedIn. We are on Facebook. We everywhere. Okay? So thank you so much. Use the hashtag. I appreciate you all. Take your pictures, post, hashtag Empowering Endo Sistas, and you all have a wonderful afternoon. Thank you.